My name is Cristina Montoya. I'm a registered dietitian and a Sjogren's advocate. Someone called me that I'm Canada's Sjogren's dietitian. I don't know what they mean, but I kind of like it. I've been living with Sjogren's for over 30 years. I don't really know a life without Sjogren's. I also have rheumatoid arthritis, and I want to help women with Sjogren's and rheumatoid arthritis take control of their gut health. By the end of the presentation, you will learn a little bit of how IBS is diagnosed and identify triggers of digestive symptoms that are beyond food, how FODMAPs trigger IBS symptoms, how a low FODMAP diet and other alternatives can ease IBS symptoms in Sjogren's. If we have time, I will show you how to identify probiotics that can help you relieve symptoms. And throughout the presentation, I sprinkled the answers to some of the questions that you sent me ahead of time. Let's dive in. Remember, this presentation should not substitute a specific advice by your physician or healthcare provider. And please do not reproduce without my consent. I'm developing these resources for you. Thank you for sharing some of your experiences. After eating, I asked over 100 individuals with Sjogren's across the globe if they had digestive symptoms in the past 6 months, and 92% of them say yes. And these are the most common digestive symptoms reported. Dry mouth is the top one, then constipation, dysphagia, swallowing difficulty, heartburn, diarrhea, and so many others. In the Euler-Sjogren Syndrome Disease Activity Index, this tool is mostly validated in clinical trials, but some clinicians use it to determine the severity of Sjogren's. This score activity mainly covers dryness and other vague extraglandular manifestations, but GI, gut is not in any of them. According to the Living with Sjogren's survey that was conducted by the Sjogren's Foundation 2021, at least 1 in 3 individuals with Sjogren's reported irritable bowel syndrome as a comorbidity. But your physician shouldn't just say, hey, your symptoms fit the IBS diagnosis. You really need to ask, can I be tested for celiac disease? Can I be ruled out SIBO, small intestinal bacterial overgrowth, inflammatory bowel disease? The diagnostic criteria to diagnose IBS is recurrent abdominal pain at least 1 day a week in the last 3 months, plus 2 or more symptoms. So it's related to defecation, changes in frequency of stools, and also the appearance. The irritable bowel syndrome is now classified as predominant diarrhea, predominant constipation, or mixed. In my survey, there was a little bit of both with the people that have experienced mixed symptoms, constipation or diarrhea. IBS is considered a disorder of the brain-gut interaction because it's not just about foods triggering symptoms. When you're experiencing constipation, it's not only about having infrequent bowel movements or have a bowel movement once or twice a week, it is also the consistency. If you go into the Bristol chart and you go to the bathroom and it's usually grabbing bowls or it's extremely dry, even if you go every day and you feel like that incomplete emptying, but you still feel like you need to do more, don't feel satisfied. And another indication that you may have constipation is diarrhea. Did you know that? So if you are experiencing loose stools, watery stools, especially in the morning or right after the meals, it may be an indication that there's a back type of stools in your bowel. On the opposite side of the spectrum will be the irritable bowel syndrome, predominant diarrhea. In this case, your stools will look more like, I don't know, sorry to show that food, but it's like porridge or really watery gravy. The potential causes of irritable bowel syndrome. And I think I really want to highlight here that there are many causes beyond food triggers. Dysautonomia International recognized that Sjogren's is the second most common cause of dysautonomia. So autonomic dysfunction, where gastrointestinal dysmotility is the most common form of dysautonomia in Sjogren. Patients with Sjogren's, they're being misdiagnosed with IBS, and they're not diving deeper into whether there's alteration in the gut motility. There's also experiencing of brain-gut axis dysfunction. It's a visceral hypersensitivity. So everyone, healthy individuals, everyone produce gas, right? What we eat, the gut bacteria ferments their foods and they produce gas. But when you have IBS or you have visceral hypersensitivity, the brain interprets that sensation as pain. And that's where that abdominal pain comes from. This is a really interesting image that was shared by a gastroenterologist, and it's how he interprets some symptoms. If you have a poor intake and you say, oh, I pass very small amounts regularly, so the physician or the healthcare provider may interpret that as, okay, we need to work on lifestyle interventions and increase fiber influence in your diet. But if you have the sensation that I never get the urge to go, or I get progressively bloated and distended, so you start the day flat. And then as the day go on, you start getting distended and bloated. So that might be an indication that your gastric motility is slowing down. And there's another problem that could happen. You always get the urge to go, but you strain, and nothing happens. So that's called a pelvic floor dysfunction. So there's that inability to tighten and relax the pelvic floor. In these cases, pelvic floor physiotherapy helps with constipation. Some of the options to treat IBS management, yes, we had the dietary interventions, but that's not the only one. We also have non-pharmacological interventions, fiber supplements, vegan probiotics, peppermint oil, and some prescription drugs, right? That only physicians can do. Remember, it's a gut-brain disorder. Psychological interventions like CBT, cognitive behavioral therapy, lifestyle, yoga, exercise, hypnotherapy has shown also benefits to improve symptoms. So I sent you email this week every day just to introduce you to the FODMAPs. But if you didn't get a chance to review it, I'll go briefly through what are FODMAPs and how a low FODMAP could be beneficial for someone with Sjogren's. FODMAPs stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Carbohydrates that cannot be digested and absorbed, causing them to travel through the small intestine. They carry all the water and go into the gut, get fermented by the gut microbes. That can be beneficial because the gut microbes take that as a substrate to produce short fatty acids to feed gut cells. That helps to maintain integrity of the gut barrier. So there's a lot of benefit for someone with autoimmune diseases. But what happens when someone cannot tolerate FODMAPs? FODMAPs are available in many everyday foods and even many healthy foods. So you have the oligosaccharides, you have dairy products, and you have the monosaccharides like fructose that could be highly concentrated in certain fruits, but also in high fructose syrups, in honey, agave syrup. My favorite fruit in the summer, like watermelon, is full of fructose. And also have fructans and sugar alcohol. So watermelon is a FODMAP bomb. Many of the foods listed under the oligosaccharides category, they add as prebiotics. Remember, the food to feed healthy gut bacteria. Unfortunately, many of us may not be able to tolerate certain amounts. I wanted to highlight something that is relevant for people with Sjogren's is that we consume products with xylitol all day long to alleviate dry mouth, to stimulate saliva production. But that could be an issue for someone who is intolerant. I'll show you how FODMAPs can cause symptoms. Let's take fructose and lactose, for example. They draw water into the gut, loosening up the stools, causing diarrhea. Some of these bacteria can stay in the gut, and especially if someone is experiencing slow gut motility, they just stay there, act as a sponge, and cause constipation. The fermentation of these foods cause gas and bloating. And as I mentioned, some of us are very sensitive to that feeling of gas and feel abdominal pain, even when physically cannot see the distension. One thing to notice that the symptom onset is generally between 4 to 8 hours. If you have a smoothie in the morning, you mixed a bunch of fruits, banana, cherries, and blueberries, and on top of that, milk. You included all these high FODMAP foods in just one meal. You may not feel the effects right away. You feel the effects in the afternoon. You may think, oh no, I ate this at lunchtime. It's what made me sick. The symptoms you may experience even after 24 or 48 hours. That's why following a low FODMAP diet is so tricky. Research has also shown that FODMAPs may increase low-level gut inflammation. They can alter the gut barrier, a little bit of leaky gut there, and the gut motility. And if you are presenting small intestinal bacterial overgrowth, you actually are feeding that bacteria with FODMAPs, worsening your symptoms. So what is the low FODMAP diet? It's a quite complex diet. That's three-phase diet plan that reduces the carbohydrates, which ferment and cause osmotic effect in the bowel. The Monash University has specialized in testing FODMAP content in foods. People at Monash University recommend that if you are going to follow a low FODMAP diet, should be with guidance. The first phase is the elimination or restriction. It's more reduction of high FODMAP foods, and this can go between 2 to 6 weeks. If you follow this restriction for at least 3 or 4 weeks, you're not feeling any relief, chances are that this diet is not going to be for you. So we have to really determine other causes of bloating and GI symptoms. Then we have the FODMAP reintroduction that could take up to 12 weeks because we have to do it slowly to really identify what are the food triggers. And then you have the FODMAP personalization or the maintenance FODMAP. And I'll give you an example. I did this diet on myself and I had done it in a few clients. I did the whole thing probably 5 years ago. And I detected that my main trigger wheat products. And it's not the gluten. It was the wheat products because of the content of fructans. Here's just a list of high FODMAP and low FODMAP alternatives. But as I mentioned, this is not a type of diet that you should go. This is the list of high FODMAP foods, and this is the low FODMAP alternative. It doesn't work that way. That's why this diet should be individualized based on your resources, on your cultural preferences, and what you have available at home. There's some risk when you're following a low FODMAP diet. There is a risk of nutritional deficiencies because you're cutting off a lot of really healthy foods that are high in fiber. And a lot of these foods are also high in calcium, zinc, and B vitamins. So some of the foods where you can find that are still plant-based and how they're a good source of calcium, you can find the almond and macadamia milk because they're fortified with calcium. Then iron you can find in hemp hearts, oats, hearts of palm, quinoa, kale, spinach. Protein foods, you have like tofu, tempeh, edamame. A great source of vitamin B12 is like nutritional yeast. So you can find that, you can add it into, it's a powder. And it's not yeast, but it's that component that is really high in vitamin B12. And it gives that cheesy taste if you just don't tolerate cheese and you want to add that cheesy flavor, that nutritional yeast is a great option to do that. Oop. Mm. So here's a really interesting question. If xylitol gum kills bad mouth bacteria to prevent cavities, What effect does it have on the gut microbiome? I was thinking, oh, that's such a good question because we chew gum, xylitol gum all day, or I do. I found a really nice review, the oral and systemic effects of xylitol consumption. Xylitol is safe if consumed under less than 50 grams a day. I would say even less than 25 grams because sugar alcohols, when you consume 10 grams a day, can start causing problems. So xylitol doesn't really kill bacteria. It creates a hostile environment in your mouth. So when you consume carbohydrates, sugars, it immediately increases the acidity in your mouth. And that's the perfect environment for bacterial growth. That doesn't happen with xylitol. Xylitol creates a film that prevents bacteria to stick to your teeth. It's so widely used in products for dry mouths and dental care. But it's also a FODMAP and it can be fermented in the gut. Some studies have shown that this type of FODMAP can also be beneficial to feed the gut bacteria. Other studies may show that it may not do it. Just to keep it safe, consuming less than 10 grams of xylitol a day probably be the safest thing to do. Pure gum chocolate mint is my favorite because it doesn't have that strong peppermint taste. Another question was, is there a difference between sensitivity and lactose intolerance? So just quickly, I want to highlight that lactose intolerance is a clinical syndrome in which lactose ingestion causes symptoms such as abdominal pain, bloating, gas, and diarrhea, and mostly due to lactose malabsorption. And it is true that up to 70% of the world adult population do develop some lactose insufficiency. So they don't produce enough the enzyme that breaks down the lactose. But that doesn't mean that you had to cut or eliminate lactose completely. When you go back to the Monash app, cow's milk is probably the one that contains more amount of lactose. But if you just put a little bit in your coffee and your tea in the morning, that's really not going to make a difference. Having half cream also has no lactose content. It's a lot of cheeses low in lactose. The body can tolerate small amounts of lactose. So you see how this diet becomes even more complex? So Monash has an incredible app. They keep updating the foods. The format load changes even in the same type of food. The regular common banana, a firm banana, green banana, is actually low in FODMAPs. But as that banana starts ripening, increases the amount of fructans. If you just have a piece of banana, it will be low FODMAP. So there is another question. Remember I told you that a low FODMAP diet doesn't necessarily need to be gluten-free. The best example is sourdough bread. They do have a bacteria starter that start fermenting the fructans of those carbohydrates. And that helps to break down those carbohydrates before it's consumed. Some gluten-free breads contain high FODMAP components like inulin. So that's what when I say that a guidance by a dietitian is so important. Let's see. Now we move into things have evolved so much over the past 10 years. My favorite recipes come from the Monash FODMAP website. So I added here on monashfodmap.com. They have tons of recipes. I take some time to find recipes that are Sjogren's friendly. What I mean is they're easy to chew, they're easy to swallow. So I sent you the links to the menu that will be Sjogren's friendly. I sent that email to you and it's all this menu. So you have the breakfast, you have the roasted pumpkin and beetroot quinoa, and also a chicken ramen noodle soup. The Monash University also have a low FODMAP certified program. Dr. Sher is a great product, but it's so expensive. Here's the menu that I sent you when you signed up. Dietary interventions is not they're not the only interventions to manage digestive symptoms. I want you to learn a little bit about the diaphragmatic breathing exercise. And they have been proven to is an effective way to encourage the body to relax. Remember, we want to stimulate that rest and digest parasympathetic nervous system. And what is the effects that it has, especially for someone who is experiencing digestive symptoms, like I said. So it lowers your heart rate, increases blood oxygenation. One thing that I learned, if you maybe you have Raynaud's disease, it improves the blood flow and brings warmth to your feet and hands. And also, if you're suffering GI symptoms, it activates the internal organs. So it may also help like just to calm down your digestive symptoms. And it might reduce the abdominal pain and that urgency to bloating and constipation. So this exercise only 1 minute. So let's see if it works. Oh, it didn't work. Good. Okay, let me see. Oh, it didn't play. Okay, I will send you this. It's only 1 minute. But the idea is basically that you're gonna take a deep breath and you place your hand, one in the chest and one in your lower abdomen. And you want to fill your abdomen. Like take a deep breath, hold it for 4 seconds. Take a deep breath, count 4 seconds. Hold it for 2 seconds and then release, count to six. But the idea is that you do that 3 or 4 times whenever you feel anxiety, even before eating a meal, and that will help to calm your digestive system down. When it's so excessive, it will really help to look at you individually. So, how is your lifestyle? What are your meal timings? Sometimes we might wait too long to eat. Like if we just wait 6, 8 hours to eat, you may produce more gas. Or if you are eating almost every 2 hours, that also stimulates your gastrointestinal tract. So just not only looking at what types of foods you're consuming, but as I reviewed earlier, you could probably look at the list of foods and see if you actually eating some of those foods that may be contributing to the production of gas. Okay. But is it also related? Are you managing the anxiety? Another thing that is worth looking into it is that are you having gut motility issues? Have you been assessed for that? Because if your gut is too slow, then that means that all those FODMAPs are staying longer in your gut. So they're staying there and fermenting and producing more and more and more gas. So is it that you need a pharmacological intervention to get that gut moving faster? One strategy that could help is like peppermint oil capsules, relax a little bit more the gastrointestinal tract. But peppermint oil has been suggested to relax your stomach and your gastrointestinal tract. But if you suffer from heartburn, peppermint oil can actually open up the lower esophageal sphincter. So the peppermint oil is better to consume capsules so that it opens down in the lower gastrointestinal tract. When I attended a webinar by a gastroenterologist specialist in gut dysmotility, the number one intervention to dietary intervention was fiber. So it has to be like a gradual approach. You don't want to add a bunch of fiber right away either, because that again is going to cause more bloating. I know there's a lot of questions in the probiotics. Fermented foods are not probiotics. For it to be a probiotic, they need to meet these criteria. These strains are known and they're being researched. They have a specific dose and they have a specific health benefits. The only product, so one of the products that meet both categories is a fermented foods and a probiotic is the Activia products. Activia is one of those probiotic foods, functional foods that are helpful to manage constipation, IBS constipation. In the US and Canada, we have what we call the probiotic chart. And these for clinicians to help you determine the right probiotic for you. So when it comes to IBS, Activia, Align, Cultural, those are really good probiotics to try in Flora Store. When you try a probiotic, you want to use one at a time and be consistent. For you to really see results of a probiotic, it will take you 8 to 12 weeks. You cannot say that you're taking a probiotic for 1 or 2 days and say, oh, no, that doesn't help. Oh, it gives me gas. For some people, when they start taking probiotics, it increases the production of gas because it's populating all the gut bacteria in your gut. At the beginning, if you're presenting unpleasant symptoms, then take that probiotic every other day, but always try to be consistent. So it's a powder, so it's not a pill, which is very helpful for us. What I've been doing in the morning is I get warm water, especially if you suffer from constipation. Warm water will help to stimulate gut motility. Then I put 1 teaspoon of psyllium husk or metamucil and maybe 1 sack of Florastor. And because it was giving me a little bit of extra gas, I started using the baby Florastor. So it's more gentle. I mix it up, have my good glass of water. Over the past 2 or 3 weeks, I've been having consistent bowel movements and I feel good. I feel that my gut is empty and I go no gas, no bloating. It takes time and patience to really perceive the results. What's the evidence on spore forming probiotics? They can pass through the gastrointestinal tract and they're forming their own kind of the gut bacteria they populate. And they specifically did a study on the treatment of functional dyspepsia, that excessive gas and that discomfort that sometimes happens. So in this study, they found that after 12 weeks of taking that type of probiotic, it reduced the symptoms. Mind you, in these patients were also on PPIs. They were taking medications to lower the acidity in their gut, but they excluded pretty much all the sick people. So diabetics, people who are immunocompromised. There's no evidence that this type of probiotic have been tested in immunocompromised or individuals with autoimmune diseases. What I don't like about this particular supplement, when you go on their website, they list a bunch of studies that, oh, it's good for gut function. I honestly clicked on at least 10 studies. They all are in vitro in animal studies. I'm so happy that you joined me in this discussion because I've been thinking Sjogren's came to me with gastrointestinal manifestations. My mom told me as a child, I was always in the ER. I was always in the doctor because I had digestive issues and they never could figure it out. And now it makes sense. So for me, the key takeaways is that individuals with Sjogren's may experience a variety of gastrointestinal symptoms that can greatly impact their quality of life. It's not in your head. Sjogren's has a role in them. Autonomic dysfunction can cause gastrointestinal dysmotility, which is frequently misdiagnosed as IBS. Individuals living with IBS often perceive foods as the main trigger, and they often choose dietary modifications as the first line of treatment. But as I showed you, it's not really the case. There is a combination of things that you can do. Consider food freedom strategies. And I didn't really get into a lot of detail where I wanted to show you the world of digestive enzymes, which is, I'm going to just take that topic for next month. So symptom management includes not only dietary changes and supplements, cognitive therapies, even toileting regime, digestive enzymes, physical movement, and a registered dietitian who is passionate about gut health, myself, can help you determine the most suitable intervention for you. I encourage you to start before you're ready. And I think that was my motto to start this series. I had all this information in my head and all this experience. And there's never the right time to start something. If there's something you can start doing today, you took away from this presentation, don't wait until the perfect time. Just start doing it. Thank you so, so, so much. So stay tuned, stay connected. And again, send me any questions or any comments. I'll really appreciate it to make this even better.